The Resilience Across Borders podcast is intended for education, support, and inspiration. I am not a psychologist or a medical doctor and do not offer any professional, medical, or health advice. If you are dealing with or suffering from any psychological or medical conditions, please seek help from a qualified health professional. Hello and welcome back to Resilience Across Borders podcast. I'm your host, Rachid, and in today's episode, we will talk about some best strategies to get the most out of personal therapy and including questions to ask your therapist. So therapy can be a powerful tool for personal growth. It can be a great tool for mental health and emotional well-being. However, like any other form of self-improvement, the benefits you reap depend largely on the effort and strategies you employ. Also, how prepared you are and how prepared you come to these sessions. And of course, how good of a therapist you have and you have selected. So with that said, here are some of the best strategies to maximize the effectiveness of your therapy sessions, along with practical questions to ask your therapist to enhance your journey. So number one, be open and honest. This is a place where you got to bring all your stuff. This is the place to bring all the stuff that you can't talk to anybody else about. So the effectiveness of therapy hinges on your willingness to be open and honest about your thoughts, honest about your feelings, and your experiences and your actions, reactions, and so on. So concealing important details or emotions can hinder your progress. This is not about looking good. This is not about presenting some kind of a manicured image. This is the place where you go to do the work. So if you are not comfortable to do, then obviously, and it's maybe because you're not feeling comfortable or anything, maybe you need a different or a better therapist. But this is like what should be happening if you have a therapist and you're actually trying to do the work. So an example, if you're struggling with feelings of anger towards a family member, let's say, don't downplay or hide these emotions. Share them with your therapist to explore the underlying causes and potential solutions. So for instance, a question you could ask is say, okay, I sometimes find it hard to be completely open. How can I get better at this? What can I do if I feel like I'm holding back during our sessions? These just are a couple of examples, okay? Number two, set clear goals. As with most things, if you have goals, then you know what you're going after, you know how to measure and all of these benefits. So the strategy for this is to establish a clear, achievable goal or achievable goals for what you want to accomplish in therapy. This can provide direction and focus for your sessions. This helps both you and your therapist to measure progress and adjust the approach as needed. Because if you're not moving closer to your goals, then obviously you can make adjustments. So instead of a vague goal like I want to feel better, go more specific. Say, for instance, I want to reduce my anxiety levels by learning coping mechanisms. Other questions you can ask is, can we outline specific goals for my therapy? This also, the therapist can help you with this. Ask good questions. Also, how can we measure progress towards these goals? Number three, be prepared for each session. Unpacking it a little bit, come to each session prepared with topics you want to discuss, questions you want to ask, or reflections on your experiences since the last session. This makes or ensures that your time is used effectively. It is in your interest to take also ownership and show up prepared. So for instance, you can keep a journal of your thoughts and feelings between sessions, and you can bring it with you. Bring this journal to therapy to discuss significant entries. If not, even just a note, whatever, one page, however you want to remember it. Other questions to ask. What can I do to prepare for our sessions to make them more productive? Also, are there specific activities or reflections you recommend I do between sessions? This is a question you can ask your therapist. Number four, engage in homework assignments. Therapists often assign homework, tasks, or reflections to be done between sessions. Engaging in these assignments seriously can enhance the therapeutic process and help you apply what you've learned. An example that may be assigned is maybe practicing mindfulness or meditation daily. So then you commit to it and note any changes in your mood or stress levels as you do this and as you practice this. Some are maybe you just review your beliefs. How are they serving you? And it may be like, what are your coping strategies or mechanisms? What are your go-to? So also a question to ask, can you give me specific exercises or tasks to work on between our sessions? Or how can I ensure I stay consistent with my therapy homework? Feel free to write this down. Feel free to take this podcast with you. Number five, communicate your needs and preferences. So therapy is a collaborative process. You communicate your preferences, communicate what you find helpful, and also what you find unhelpful, and any concerns you might have about the whole process, the therapy process. So, for instance, if you feel a certain therapeutic approach isn't working for you, discuss it with your therapist and explore alternative methods. Do not be shy about this, right? You could say, I feel like we're not making progress with this approach. Can we try something different? Or what are the different types of therapy can we explore? For example, a lot of people just fall into this trap of intellectualizing this process and always talking and not really incorporating, like, for instance, somatic techniques or other strategies and tools that help release traumas and unlock repressed or hidden emotions or process them in a healthy and in a healing way. Again, don't be shy about asking for what you need. And number six is to be patient and persistent. Change takes time, and therapy is no exception. Be patient with the process, but be persistent in your efforts, even when progress seems slow. So understand that addressing deep-seated issues like trauma or chronic anxiety may take several months or longer. Celebrate small victories and keep the long-term benefits in mind. And questions to ask to this regard is, what is a realistic timeline for the progress I hope to achieve? Or how can I stay motivated when progress feels slow? Again, leverage this relationship, leverage the expertise of the therapist, right? So number seven, build a strong therapeutic relationship. A strong, trusting relationship with your therapist is crucial. So ensure you feel comfortable and supported, and don't hesitate to seek a new therapist if the current relationship isn't working. If you feel judged or misunderstood by your therapist, it may be a sign to find someone else who better fits your need. You can ask him or her what work they have done to overcome their own bias or biases as well. You can also ask them, how can we improve our working relationship? And then you could always ask yourself or ask others or ask even the current therapist, what should I look for in a therapist to ensure a good fit? So this question is a double bonus because you see how they answer it. Maybe the response is helpful to you. Maybe it's also in its own. Maybe with that response, you can actually get a better idea if they are a fit for you or not. Number eight, take responsibility for your growth. Ultimately, therapy is a tool to help you help yourself. So take responsibility for your personal growth and apply the insights and strategies learned in therapy to your daily life. If you've learned techniques for managing stress, actively incorporate them into your routine rather than waiting for your therapist to remind you. Again, more questions you can ask is, what steps can I take outside of therapy to enhance my progress? How can I be more proactive in my healing journey? What other topics or areas should we talk about? How did we pick the ones we are talking about now? Or how did we pick the ones we already talked about? This is to get an idea of what approach your therapist has and is using and how they evaluate things, and also to make sure it is relevant to you. You can also ask, how will you know when you no longer need therapy? So again, these you can use as a reference. You can ask each time, or If you're in the evaluation process or whatnot, you could probably pick the ones that are relevant for that. But, anyways, maximizing the benefits of therapy involves a proactive, engaged approach. By being open and honest, setting clear goals, preparing for sessions, engaging in homework, communicating needs, being patient, building a strong relationship with your therapist, and taking responsibility for your growth, you can make significant strides in your mental and emotional well being. Remember, therapy is a partnership, and your active participation is key to your success. As always, thank you for tuning into the Resilience Across Borders podcast. If you are enjoying this podcast and finding it helpful to you, please pick up a copy of the companion journal by yours truly called Emo Gym, EMOGYM on Amazon. You can follow the blog posts and new episodes as they get added at this URL at resilience.com. ATRESILIENCE.com. Remember to be kind to yourself and be kind to others and stay resilient.